Prime Minister? Well, of course, different scientists may have slightly different views. So let's hear from two of them. Professor Carl Heneghan, who's Director of the Centre for Evidence-Based Medicine at Oxford University, and Dr. Adam Kucharski of London School of Hygiene and Tropical Medicine, who's a member of what's called the SPY-M group. It's not about spying. It advises that SAGE emergency group on modelling the virus, though he's speaking to us in a personal capacity. Morning to you both.
Morning.
Morning.
Can we begin with what you think the scale of the problem the country faces now is? Dr. Kucharski, so first of all, how would you sum it up?
So I think we're seeing some troubling early signals. So we're obviously not at the point where that's translating into substantial burden on healthcare, although we are seeing things creep up. But I think we are, from testing, getting to a point where potentially we're losing our ability to accurately track the virus. And first of all, that means we could have a situation where it's getting into risk groups. We start seeing more severe cases appear and we don't have good warning of that. Secondly, it also affects our ability to have more targeted, nuanced measures. If we lose the ability to track the virus, it ends up that more blunt tools will be deployed. That's obviously what we saw earlier in the year. So I think we really have to be thinking what's required now to stop us getting to that point where these incredibly blunt tools are used. How can we actually have something more sustainable in place?
Professor Heneghan, you've been one of those who've been a bit wary of some of the figures, suggesting at times that they've overstated the problem we face. What do you feel now?
Well, look, most of the problems here occurred, if you look at the data, after the bank holiday Monday from about the 2nd of September onwards. So you can argue that one of the issues here that happened is significant people met throughout that weekend, and then we've had a bit of a surge. But the language of out of control, need more testing, this is terrible, needs to be dialed back. Look, we have problems, significant problems, but we also have shifting policy every day now. So I think what we've got a huge problem here is we're losing the trust of the population. You just heard it from Johnson, you should report you shouldn't report you. This is a huge moment right now. And what we have to do is slow down our thinking, pause, and start to be more analytical about the steps we take, because as we've done, as we rush in, like with the test and trace program, it's falling over. And so we have to be more thoughtful and analytical.
OK, well, let's then look at the numbers, though, because there is a worry, as you say there, Dr. Kucharski, that we simply don't know how many people have got the disease. Now, Anthony Costello, well known in this field, a former director of the WHO, tweeted last night that he was hearing from a well-connected person that government now thinks, in the absence of testing, there are 38,000 infections a day. I think the official figures are around about 4. And he goes on to argue that, or to report that Chris Whitty is advising the Prime Minister for a 2-week national lockdown. We can't confirm that is the case. But what do you make of that suggestion? It could be on a much bigger scale, and we might have to have a national lockdown, Dr. Kucharski.
Well, first of all, I don't want to second guess what may or may not be discussed. I think there's going to be a large amount of uncertainty on that infection. I think that's one key point, that as the awareness and the data gets poorer, there's more uncertainty.
But could it be on that scale, and could it require that scale of response?
I think where we are now, if we have seen growth and if the testing bottlenecks mean we're not getting an accurate picture, potentially we could have a very large number of infections increasing. I think that the
Professor
challenge
Heneghan?
here is...
Let me just put that to Professor Heneghan.
Yeah, look, there is a possibility it could be that high. One of the key issues, though, about how many people have the infection, what we want to know is how many are symptomatic versus asymptomatic. Number 2 is a lockdown for 2 weeks is no evidence, but actually would be a mistake, because all you do is delay what is going to happen, the inevitable as well. And what you do is you push it further into winter, when actually the consequences could be more dire. At some point, the government and the advisors are going to have to start to realise that this infection is endemic, and then they're going to have to set a clear objective, which is missing at the moment. There is no strategy about our response.
So in other words, just to be clear, Professor Heneghan, you're saying, look, we can't get rid of it. Stop trying, protect the people we really need to protect, and live with the fact that many other people will get it. Is that right? A fair summary of your position?
Look, this is an incredibly important point, because if we don't accept it's endemic, we then don't start to say, look, we need to really protect those who are the most vulnerable.
OK, let me put that to Dr. Kucharski, if I could. Do you think that approach is right?
I think the idea that we can kind of sit back, somehow mark off the risk groups and let it go through the population isn't something that's feasible. First of all, the risk increases not just in the very elderly, in the over 50s, over 60s. Are you going to push those people out of society for a prolonged period? You've also got this issue that, as I said, if you lose track where the outbreak's happening, it's much harder for individuals to manage their risk. If people in risk groups know what's going on locally, they have a much better sense of how they can manage and essentially live alongside the virus and manage that risk. If you lose control and you lose visibility, it's much harder to do that.
Just a few more seconds each, if you would, just to say then what government might do. Let's be positive. Even if you disagree with this strategy, what could they do? Are curfews for pubs and bars the right approach? Bans on households getting together the right approach, Carl Heneghan?
No, they're not. A consistent messaging approach, which sits back and say we're going to have a straightforward messaging approach. We're going to look to broader countries like Sweden and Germany, learn from them and use them to direct some of the strategy as opposed to panicking all the time.
Dr. Kucharski?
I think sustainability is key here. We're not in the situation, say, where we're mid-March. We're probably closer to, say, late February, early March. So we have the opportunity to use the data we have and think in the longer term and really get things in place that don't avoid a repeat of where we were earlier in the year.
But to be clear, what does that mean in practical terms for people? They are likely to face closures of pubs, bars and restaurants nationwide, are there? Tenor, I know you can't tell us what will happen. Yeah. I'm asking you what should happen.
I think in practical terms, it's always preferable to target interactions in a way that doesn't disrupt things that are going to result in businesses having to open and close short notice, widely impacting people's lives. So we've seen in countries, as was mentioned, places like Sweden, others across Europe, things like limits on social gatherings, really kind of targeting it where transmission's happening. Again, the more information we have, the better.
And a final thought about that information, Dr. Kucharski, you are a modeller. We haven't got it now, have we? This testing system means we simply don't know, do we?
I think we're at a point where the case data is becoming less reliable. And then, unfortunately, you're relying on these more delayed metrics like hospitalizations, and it's much harder to do anything targeted.
Sorry, I'm a journalist, and therefore I tend to be a bit cruder than you. We don't know, do we? We don't know the scale of the infection. We don't know where it is.
I think we are getting to a position, where there's increasing uncertainty, and that is worrying.
Dr. Adam Kucharski, Professor Carl Heneghan, thanks for joining us.